But when I think of equity, I think that everyone in our community, no matter what age they are, no matter what race, gender, whether what socioeconomic background they have, or what their sexual orientation is, they're allowed to reach their full potential. And they're given all the resources they individually need to reach their full potential. And when we moved into the pandemic and people started retreating, working from home, doing a lot of their activities at home, a lot of things were closed down, it really put a spotlight on the disparities and really made them worse because individuals who relied on going to school to get their meals, individuals who relied on going someplace in person to get their education or get their jobs, might not have been able to. We took a lot for granted in how the majority of our population functions and could remote easily, and so many in our community couldn't. So that created a disparity. And then the health disparities were there already. And then we saw them exacerbated because they were already vulnerable because of hypertension, lung disease, diabetes, and then they were often working on the front line. There's still so much work that needs to be done because what we know for sure is health disparities is more than just the delivery of health care. It's your education, it's your transportation, it's the type of job or income you have, it's the type of housing, where your housing is. And so we're working in all of those arenas as well as specifically in healthcare delivery to help reduce the health disparities we see right here in Columbus and Franklin County. So I encourage people who don't understand it, ask someone who doesn't look like them, doesn't have their same background, and ask them what their experience has been like when they seek healthcare. As an African American, as a woman, and as a physician, I've seen it and I've experienced it. And there have been times I have to call it out, whether it's for my own care or the care of a loved one. And so I think it's very challenging for people to understand it when they haven't experienced it themselves. Get some information. Expose yourself to individuals that don't look like you, don't act like you, and try to understand where they're coming from so that at least you have that frame of reference now so that you can appreciate it a little more. And I think once you get that frame of reference, you're going to get a fire and an energy inside of you that's going to make you want to act and do more to help overcome these health disparities.